for his scientific efforts to monitor the movement of electrons. In a phone call, Makram congratulated Tharwat, a professor at the College of Optical Sciences in the University of Arizona, for his scientific brilliance, which has placed him among the list of the most prominent Egyptian scientists abroad. She also hailed the efforts of Egyptian scientists and experts in various fields, affirming that they are a part of the soft power that highlights the Egyptian great civilization as well as ancient history. She expressed appreciation of the research efforts made by Muhammad Tharwat, who is following in the footsteps of the late Egyptian great scientist Ahmed Zawil. Egypt has received the third shipment of the AstraZeneca COVID-19 vaccine, 1 million doses, via COVAX in cooperation with the Gavi, or the Alliance, formerly the Global Alliance for Vaccines and Immunization. The third shipment comes in light of the state's plan and keenness to provide all types of vaccines for citizens to enhance societal immunity against the virus and its variants. On December 31st, 2021, Egypt received a shipment of 347,460 doses of the AstraZeneca vaccine via the COVAX facility. By the end of 2021, Egypt has administered a total of 55,662,624 million doses of the coronavirus vaccines, according to the Acting Minister of Health, Khaled Abdel Ghaffar. Welcome back, and we're now delighted to be joined over the telephone by Dr. Maysa, Shawky, Professor of Public Health from Cairo University. Dr. Maysa, very good afternoon to you, ma'am.
Good afternoon to you and to all our viewers.
Thank you, Doctor, for joining us. First and foremost, now Egypt is still in the process of receiving more vaccinations from the COVAX facility, as well as different areas from all around the world. The importance of these vaccines, especially as Egypt is trying to reach societal immunity and has already opened the third booster shots for people who have had their first 2 doses and have passed 6 months. How important is that step in the fight against the pandemic, Doctor?
Well, this is an important point. Actually, Egypt has imported lots of vaccines at the beginning of the pandemic, and we went into the manufacturing process of the vaccine here in Egypt, and we offered the people the free vaccination all over the country, and we have also enforced certain legislation for the governmental employees and all people into the governmental and public places to show their vaccine certificates. Now we are into the booster dose, and this is for the aim of getting the people's immunity much better facing the new emerging viruses, like the Omicron and so on. So right now we're having furthermore imported vaccines to make the vaccine varieties all available for all the boosters that are required.
Yes, absolutely. Doctor?
And actually, you are also seeing that the daily reporting of the new cases has declined, and the mortalities also have declined.
Yes, Doctor.
So this is ensuring something that we are on the correct path.
Indeed. Dr. Maysa, vaccinations reduce the severity of the symptoms of people that become infected, and even now with the Omicron variant, the illness itself is believed to be less serious, still of course serious, but less serious than the previous variants. How important is it to get vaccinated, especially during now that we are on the 5th wave of the coronavirus and the different variants that have evolved since the pandemic began?
Well, as a public health specialist, I would like to tell all the people who are not vaccinated yet up till now that you have to hurry for the vaccination and to be fully covered with first and second dose of the vaccine if it is a double dose for completion of immune response. And it is important for all age groups to become vaccinated, especially so in Egypt that we have offered immunizations for children 12 years and above.
Absolutely.
This is very important nowadays because young children, when they get when they catch the virus, they transmit it to their homes, to their parents and their grandparents as well, with mild symptoms.
Or more, yes.
The others get infected with the serious disease. So let's cut off the cycle and reach a good level of herd immunity in the near future.
Absolutely. I'd like to thank you very, very much. Dr. Maysa Shawky, Professor of Public Health, Cairo University. Thank you so much, ma'am, for your time. A short break, and we'll be right back. Stay tuned.